The Confident Stock podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome to the Confident Stock podcast. I'm Dr. Rednam, and I'm a board-certified plastic surgeon in Houston, Texas with my Houston surgeons. And we have a special guest today, Dr. Karen Horton. She is a plastic surgeon who is based out of San Francisco and is the owner of San Francisco Plastic Surgery. Welcome to the show, Karen.
Thank you so much for having me. This is so fun, and it's an honor to be featured on your podcast.
So I have had the pleasure of actually getting to know Karen over many years now, and she is a very well-respected and talented plastic surgeon, but not everybody knows how you got to become a plastic surgeon. So tell us a little bit about your story.
Okay. Well, I am in my 19th year of private practice. I am a surgeon's daughter. I'm the oldest of three girls. My dad was a surgical oncologist at the University of Toronto. So I'm born and raised Canadian, although now I'm American as well. And he was a breast oncologist. So I grew up knowing that being a surgeon was very important. He was very busy. But to be honest, I never saw what he did. He worked a lot. He was very busy. But I never really grew up wanting to be a doctor or a surgeon. If anything, I thought, well, I don't want to do that because you work all the time and, you don't see your kids.
Yeah.
But, I ended up gravitating towards medicine because I followed my forte in school, which was math and science and also art. And if there wasn't a perfect marriage of all those three things together, as you know, it really is plastic surgery. So I did a master's in cancer research before I applied to medical school, which I quickly learned was not for me, but I did finish. And that's what drove me to medical school. And going into med school, I always thought I was going to be a pediatrician because I had always worked with kids and I love kids. But then I found out that pediatrics also wasn't really for me. But we had a mentorship program at the University of Toronto, and I could be matched with any type of specialist I wanted. And I was newly married at the time, and I do want to give my husband credit. I came home from med school, and I'm like, hey, what should I find out about? Thinking I would do something with pediatrics. He said, you should really look into plastic surgery. And I'm like, really? Why do you say that?
It sounds like you do owe him props for that.
I do. Because he said you can use, your interest in art and body image and self-esteem. And he was also thinking long term, you don't always have to bill insurance for surgery. So there is, income potential that isn't available for all surgical specialties. And so I got matched with a craniofacial surgeon, Dr. Chris Forrest at the University of Toronto. I ended up doing 2 summer research projects with him. And through Dr. Forrest, I really learned about all the different areas in plastic surgery, head to toe, all different, body types from soft tissue to bone to nerves, tendons, breast tissue, fat. And then I said, that's for me. So here I am.
Sometimes your path just finds you, right?
Yeah. Definitely.
So how did you end up in the U.S.? Did you do you did most of your initial education in Canada?
Right. Yeah. So I did probably more school than you needed to. I did undergrad, 2-year master's, 4-year med school, 5 years of integrated plastic surgery training. And then I came to San Francisco for my very last year of training in reconstructive microsurgery at the Bunkie Clinic. And 6 months into living into San Francisco, I'm like, I need to stay here. And so I looked around at different job opportunities. I looked at academics. I looked at managed care. I looked at group practices. And I was fortunate enough to be connected with the group that I did join. And there was 2 other women plastic surgeons at the time. They did a lot of the advanced breast cancer reconstruction in town. And so I was able to do microvascular breast reconstruction, immediate direct to implant reconstruction. And they already had a great referral pattern to this practice. And so since that time, I took over the practice. I've grown it. We moved across the hall. We built this beautiful new office and a full operating room. And I no longer am doing primary breast reconstruction. I stopped taking insurance a few years ago, but I still am serving breast cancer patients now because I perform a lot of complicated breast revision surgeries. So that's what brought me here. It was 2005. I'm in my almost 20-year anniversary being in San Francisco, and I'm so happy to be here. It really felt like home.
Does it feel like it's flown by?
It really
like looking back? Yeah.
Yeah, like since that time, my practice has changed. I've had twins. They are graduating 8th grade. They're going off to high school.
My goodness.
Like, I don't feel like I'm 54 years old. It's like, what happened?
So you're in California, you're in San Francisco, I'm in Texas. It can often be very different aesthetics between different major cities. What would you say that you see a lot of in San Francisco that is like, yeah, this is very typical for this area?
So I think the typical San Francisco patient, both women and men, is they want to look natural. They don't want to look overfilled, obvious, it's like Northern California is more like New York to Southern California, which is like Las Vegas, or maybe Texas, bigger is better. But most of my patients are just like you and me, working moms. I had a breast augmentation 6 years ago. I blogged about it. I share my experience. I share it freely with patients. And I say, listen, I'm slender. I want to look natural. I exercise every day. I didn't want to have a procedure where I would need to change my activities or have a big, long downtime. And so I would say wanting a natural look, everybody wants to look like themselves and put their best face or body forward, but they don't want the results to be obvious to others.
Would you say that people are very open about things that they have, or it's a lot more like people have quite procedures?
I think it's generational. So I'm Gen X. I do see, patients who are a generation older than me. I see a lot of people in my age group, which is what happens as you graduate through your practice. Your patients age with you. And then, I see the millennials and some Gen Xers. I would say the younger the patient, the more open they are to sharing. And they often, like my younger patients, are often finding out about procedures on TikTok. They follow people on TikTok and they share their whole experience. That's not something that I think I would have done when I was a plastic surgeon. And so I think people are becoming more open. But like when I'm at a dinner party or cocktail party, somebody will say, hey, can I ask you a question? But they won't be in public, whereas other patients will.
Yeah. And I think you're right. And I think a lot of that is social media, right?
Yeah,
it's just
definitely.
that everybody wants to know everything about everybody and they're interested. It's not always to point out things on people. They just are so interested. Like, how'd you do that? How'd you get there?
I agree. And you know what? I have to give you credit, because I know you had a procedure and you shared it on social media, day 1, day 2, day 3. And I thought that was so awesome. I think it's brave of you. You were very transparent, open, honest. Education was the goal. And I think you did such a great job.
Well, thank you. I was very inspired by you because I saw you had done that as well. And I think that you can probably agree with me that it helps me connect with my patients. And, if I've been through it, I really do have a better understanding than maybe the average person. I don't think you need to have had every surgery that we perform to understand, but I do think you may not recognize me, but I think it does help that when there are things that, we want to do, that we're humans too. And there's things we like to change, and we can better care for our patients when we've had some of these experiences.
Definitely. Yeah. Being on the other side of the table or the knife or the syringe or whatever it is, I think it really, as a surgeon, as a doctor, it makes us more empathetic. We've had the same fears. We've had swelling and bruising, and we get it. And just little things like, how do you talk to your kids and particularly your daughters about the fact that you're planning surgery, having surgery? There's concern that moms have, am I giving my kids the wrong message? Are people going to think less of me? But I think that, sharing is caring, and it's great to share your experience because, again, education is key. This is not a reality show that we're putting on when we share on social media, but I think it's so valuable. And I've gotten very similar feedback from my patients. They really appreciated me putting myself out there. They can see that I understand where they're coming from, and they know that I'm a patient too.
And I think you make a good point. Like, we're both girl moms, and like, there's always this concern that like that we are teaching our girls not to love themselves if by what we do, or if I have a patient who comes in is like, I don't want my daughter thinking that I'm doing this for the wrong motivations. And I think that the more that we're open about it and we're explaining, no, it's not because I don't love myself, it's not because I'm not confident in who I am, it's, and we're honest with it, then our children will be able to make decisions based on the right decisions or the right motivations as well.
Yeah, I completely agree. And I think the younger the daughter, the more simple their questions are. And what I'll tell patients is when they're saying like, oh, like, how do I talk to my daughters? I said, well, especially when they're younger, they want to know two things. Number one, does it hurt? And number two, am I going to have to do that? And those are exactly the questions that my twins asked me when I said, hey, you know those squishy things in my office? I'm going to get them put in my boobies. And they're like, oh, they didn't ask why. They didn't ask like, what's going to be. They're like, oh, does it hurt? And oh, when I'm older, am I going to have to do that? To which I said, only if you want to. You might not need to. You might. We'll see. But no, it's not scary. And if you have questions later on, come and talk to me.
Yeah.
And then I want to know what's for dinner, and can you jump on the trampoline with me again?
Yeah, it's so funny, right? They just want to know the basics. They just want to know that you're fine. And I think that there's even actually books out there that like how to tell your daughter you're having a breast augmentation, or how to tell, for any type of surgery, not just what we do.
There's one, I think, entitled when Mommy's Having a Mastectomy or something like that.
Yeah. And I love that. I'm really enjoying this age of transparency, even amongst celebrities. We've had quite a few popping up lately that are like, hey, guess what? And, I think it sets more realistic expectations that, hey, guess what? The only way you're going to get this look is with surgery. It's not like I magically drank this tea.
Right. Yeah. Although they will credit their trainer and eating avocados. Oh,
yeah. That too. And olive oil. Olive oil does miraculous things for people. Yep. So tell me a little bit more about like your practice, how it's changed. I know you said initially you were doing a lot of reconstruction. Now you're doing more secondary reconstruction. What other types of procedures do you do in your practice?
So I'm not taking insurance. So I'm not doing the primary breast reconstruction at the time of mastectomy. I do a lot of breast surgery, probably at least 55% of my practice is aesthetic breast surgery, but some of it is a complicated revision, either cosmetic or reconstruction. I do a lot of body surgery, abdominoplasties, liposuction every single day. I do a lot of labiaplasties, nipple surgery, earlobe surgery. I'm doing more upper lid blepharoplasties. I don't do as many lower, and I won't do, functional procedure of the lids. And then I'm doing more neck lifts. I do a procedure called the max lift. And because, looking in the mirror, looking at my own mother and how she's aged, I know that I will probably be looking for personally an upper lid blepharoplasty and a neck lift, because the neck is really what bothers women and men as they age. I don't do noses. I'm not doing, again, insurance-related procedures. I don't take call. However, I'm on call for my own patients 24/7 every single day. I do give my patients my cell phone number. I know a lot of people don't, but I do. And I'm just make myself available to them. So I think transitioning from reconstruction to aesthetic, and I've only ever performed surgery. We do offer non-surgical procedures in my practice, but I have a nurse practitioner who performs all of those procedures. And we're actually hiring another one and growing the non-surgical side of the practice.
That's amazing. It sounds like you built a really beautiful practice.
It's great. And everybody who's a member of our team is here for the right reasons. It's for the patient. Every patient's a VIP. Everyone plays a really important role in caring for the patient. And I think we own it. And you can tell everyone is so happy to be here. We love what we do.
And, I've had the privilege of getting to talk to so many amazing plastic surgeons. And it's always a recurring theme about how much everybody cares about their patients. So sometimes it makes me sad when I see people have such negative connotations when it comes to plastic surgery, because everybody I talk to and I know just like they couldn't care. They care so much about how their patients are doing. The fact that you would give your patients your cell phone number, it just speaks to like that you're not just caring for their body, you're caring for their whole mind.
Yeah. And that's what I say to patients. When I meet a new patient, I say, listen, this is going to be a really long conversation. I am more relational as opposed to being transactional. And if a patient ever comes in and they want to say, what's your schedule and how much? I already know immediately it's probably not a good fit.
Yeah.
When I get to know patients, I say, listen, we're going to get to your breast or your tummy or whatever you came in here to talk about. But first of all, we like to get to know you, and we get to know our patients head to toe, inside and out, because we really care about you as a whole person. And I think kind of like we're doing now, we already know each other, but it's kind of like a get to know you back and forth. I ask about their family and how did you and your partner meet, and tell me about work, and like, what do you like to do when you're not working or whatever. And we just really establish a really nice level of rapport and trust, almost like a friendship, kind of like dating. But then by the time we end up talking about the procedure, I basically tell them about the whole surgery or the spectrum of procedures on the menu that they might be a candidate for. We examine patients last, and by then they're very comfortable because, as you know, coming in and showing the body part that you're self-conscious about to a complete stranger, first off, is usually not that.
Yeah, it doesn't feel that great. It doesn't feel that great.
And then the examination part takes like 30 seconds, and it's like, hey, we're all good. Let's go for it. And it's really nice. I get great feedback from patients and also consultants who come through the practice from time to time, and they say that our booking rate, successfully scheduling surgery after a consultation is very high. And I think a lot of that is just the time that I take in the initial consultation, also the rest of my team, where their goal is education and just letting patients know that we really do care about them. And then we keep in touch with our patients. We see them in the long term for social visits, but long-term follow-up.
Well, I don't doubt that you've probably taken care of families, right? Like this person's mom, this person's sister,
Yeah. Yeah, I've read on a lot of friends and peers. Yeah.
And we have students sometimes that come through, and I always tell them, I'm like, one of the coolest part about surgery with plastic surgery is that we build these long-term relationships that you don't necessarily have in any other surgical specialty.
Yeah, I agree. And as you know, the body changes with time. There's something called the fourth dimension of time and gravity. And especially if we're looking at a breast reconstruction, the reconstructed breast is going to age very differently than a natural breast on the other side. Also, there's changes related to aging, menopause, which I'm knowing all about, and, just different changes post-pregnancy. And so we let patients know that our goal is to help them be their best self, feel good, look good, but we will want to see them in the future. Things might change, and it doesn't mean they're going to need additional surgeries, but we basically want to monitor, see how they're doing, and if there's something we could offer them down the road, we'll have a conversation, knowing that it's never a hard sell.
Exactly. Like you said, we don't stop time. We sometimes reverse it. And other times we're there along as you continue to heal and age.
Yeah.
So you brought up labiaplasties earlier.
Yes.
And I would love to talk more about this because this can be a really taboo or embarrassing topic for a lot of women. But so many women have concerns and they don't know how to address and ask about them. So tell me a little bit about how do people find you for this and what exactly does the procedure involve?
Okay, so labiaplasty is a procedure I do a lot of. Some weeks we'll do one, and other weeks we'll do 4 or 5. And I think I only saw one in my training, so I actually didn't know that much about it. I had been in practice for several years, and I got a call from one of the older male plastic surgeons in town who called me. He's like, Karen, I'm sending you my patient, something to do with a vagina. I said, you take care of it. And I went, oh,
okay,
there's a need. So, I reviewed the techniques. I made sure I got up to speed. And my first patient, I think anytime as a surgeon, if it's the first one you're doing in practice or the second or third, or even like the 50th, I think it's really important just to be very upfront and say, hey, this is a procedure I feel comfortable with, but I want to let you know I don't do a ton. Anyway, the technique that I do is called the trim technique. And I say it's kind of like trimming your bangs, but down there. Many patients don't even know what the name is for labiaplasty, but what they know and what they experience is that they're uncomfortable. The labia minora, which is the inner lips of the vagina, hangs longer and lower. It bothers them if they wear tight pants, yoga pants, sometimes even a bathing suit. They're worried if they cross their legs, the tissue might slip out. Sometimes they have discomfort with sex. Sometimes it's with athletics. And other times it's purely aesthetic. They say, I don't like to look down there and see the tissue hanging out. So I say a labiaplasty is either for functional concerns, meaning they want more comfort, or it's for aesthetic improvement. But the goal is just to trim the excess, the part which is more darkly pigmented and has an irregular cobblestone-like texture. We don't want to take away all of the labia because it does serve an anatomic function. It's there for normal lubrication and it's there to prevent friction. So the part that we're going to keep is up higher. It's more smooth and shiny and more light pink in appearance. And we do this procedure awake under local anesthesia. We always prescribe an oral anti-anxiety pill for our patients, one the night before, one the day of. We have inhaled laughing gas for them to breathe. We have an all-female team, a nice warm bed in the operating room. We play whatever music they want to listen to in the background. And I think once patients know this is a very routine procedure for us, we're going to make sure they're really comfortable. Yes, we will inject numbing. No, that won't feel good, but probably only for a few seconds. We use a combination of short-acting numbing mixed with long-acting numbing. And once the numbing is injected, they're all good. And they end up chatting with us. We have several members of our team in the room, all women. And they say, you know what? That was kind of fun. I just felt like I was chatting with girlfriends. And so the trim technique involves just trimming the excess. We have a little grounding pad on patients, and we use a little electrocautery pen to zap blood vessels. And we suture everything together with 3 layers of dissolving stitches, so they don't need to have any sutures removed. I recommend 1 week off work, 3 weeks before exercise, and no submerging in water for at least a month. And most patients are happy, but they're happy in a way that you probably wouldn't expect. They'll come back at 2 weeks for a really quick check, and it's still swollen, maybe bruised, and they're like, "Ooh, it looks kind of weird." I'm like, "Yes, it does. If possible, don't look." We'll show them with a handheld mirror right when we're done. And they'll say, "Oh, yeah, it looks great." I say, "Okay, next time you look, it'll look ugly and swollen." But then they'll come back either at 6 weeks or 3 months. And when I say, "How are you doing?" they're like, "Oh, I've been meaning to look and tell you how happy I am, but I keep forgetting." And I say, that is so awesome, because if it falls off their radar and if they're not really aware of that body part, if it doesn't bother them anymore, then we've done a good job.
Exactly. And I think that for a lot of women, there's no perfect normal, right? There really is no normal, but like everybody has a feeling of what normal feels to them. And so it's like you're achieving that for them, and they're so happy. It's a wonderful feeling.
Yeah. And like, they don't want to look like a porn star or anything like that. They just want to not be bothered by it. And so if we can help them achieve that with surgery, and again, surgery's not for everyone, then it's such a great procedure. So, yeah, we do lots of labiaplasties.
I'm sure people raise their eyebrows sometimes when they hear it, and they're like, awake? Why would you do it awake?
Yes. Now, I used to do surgery. I used to bring all my patients to the local hospital 3 days a week for 15 years. And then the pandemic hit, and so everything changed. But I actually had probably about 10 labiaplasty patients scheduled. And then it was COVID, so we couldn't do any surgeries. Patients started calling the office and saying, like, "Can't you do it in the office?" And I'm like, well, I guess we could try. Just like, don't tell anybody, because I wasn't sure whether we were allowed to do surgery. But we started offering patients surgery awake. And you know what? They actually really appreciated not needing to go to sleep, not being nauseated afterwards, not having all the drugs. They also got to see it at time 0, like I mentioned. But before that, when patients would go home after general anesthetic, they'd be really out of it for a day or two. And by the time they looked, they'd be like, ah. And so I think it's really empowering for women to know what we did. It actually wasn't that scary. They can also see the tissue we removed, and they kind of feel like they're part of the team. And again, we make sure they're as comfortable as possible. But once the numbing's in place, other than a little tugging and pulling, they don't really feel anything. And so patients are really happy that they didn't have to go to a hospital for a procedure that they might feel a little self-conscious about, and less drugs, easier recovery. And so, yeah, it's worked out really well.
And I disagree. I do my labiaplasties awake as well, and I like that you can literally put a mirror and be like, "What do you think?" You know, it's just, and I think that they feel better because they also have like a little more control in a way for what they're seeing and what's happening to them. And so, I love doing stuff awake when it's something small like that, and then you don't have all those side effects that you have to deal with.
I completely agree. I think a lot of it is the control issue and just being empowered. And so, I think it's great. I do actually a lot of awake surgery. Implant exchange, as long as we're looking to do a major modification of the pocket, we do a lot of implant exchanges. We do implant removals. I had one patient, she was really tough. She said, I am not going to sleep. And can you do all of this awake? And we did. We did upper eyelids,
Yeah.
mini abdominoplasty, basically just removing some extra skin over her C-section scar, a little bit of abdominal liposuction, and a labiaplasty. And she did amazing. She actually went to sleep. Well,
It's the magic of local anesthesia.
I know.
What are some things that you are excited about in the world of plastic surgery? Like everyone has something that they're like excited is coming out soon, or that you're going to be adding to your repertoire of things you perform.
That's a good question. So, I'm not an early adopter of most technology. I keep my ear close to the ground. Hot topics at our professional society meetings is always one of my favorites because I love learning what's not FDA approved yet, what's coming down the pipe. And then I like to follow it forward in time. Currently, we don't have any, fancy new machines. We're not really a machine-based practice, but there are some upcoming technologies that I'm carefully watching and waiting to see how they do. And so, yeah, I'm just going to leave it at that because I don't want to name any name brands, but energy-based devices, honestly, I have not been that impressed with. But everybody wants a non-surgical option for this. Tightening the skin, is there something we can do without surgery, without downtime? Maybe, maybe not. It's tough. Neck is usually surgery. But, I am a plastic surgery patient myself. I mentioned I've had a breast augmentation. I had some liposuction here. I get injectables done regularly in my office. And so if anything, rather than trying it on a patient first, I might be the first one to try it. And I'll share it with everybody.
Well, and I think you make a really good point for any potential patients listening is like, it's okay to wait. I know sometimes the latest and greatest comes out and you see it on TikTok and you're like, I can't wait. I want to do this. But it's good to give it a little time and see what those long-term results look like. Because sometimes they look so amazing initially and then you're like, was that worth me spending that money?
Yeah. And I will find out which of our colleagues have invested in that technology. And then I'll ask them 6 months later, 2 years later, 5 years later. And usually the answer is, it was disappointing. I don't use that anymore. Okay.
Yeah.
Good to know.
Yeah.
Good to know.
Yeah. Things that work will be around for a while.
Yeah,
so
definitely.
You don't have to necessarily rush to go do it.
Yeah. And, patients are always asking, like, what's new, the latest and greatest? Well, yes, we have a new breast implant.
Yeah.
But I tend to do things that are tried and true. They're reliable, they're FDA approved. Have my surgical techniques changed dramatically in the last 2 years? No, probably not. Like little nuances, like I'll try a different type of suture, or now I'm irrigating with phase 1 solution, which is dilute hypochlorous acid rather than the triple antibiotic solution for breast implant surgeries. That was something new because it also has a very mild coagulation effect on the inside. I love drains. I always use drains. I know other surgeons never use drains. And what I tell patients is there's so many different ways that we can do things. There's not like a one-size-fits-all approach. Just like if you're a chef, you have a particular way that you make your favorite dish. And if you go to a restaurant, you might say, oh my God, this is amazing too. And it might be a completely different recipe. And that's okay. I think every surgeon does what they feel comfortable with, which is appropriate, and what works well in their hands.
Yes, absolutely. And you don't want to get somebody off of their game. So if that's what their standard practice is and you love their results and you love them, then you want them to continue to do what makes sense for them and makes them feel comfortable too.
Definitely.
As well.
Yeah.
Well, this was so nice chatting with you, and thank you for being part of the show today. If somebody's listening, they're like, she sounds awesome. I want my wake labiaplasty. How do they find you?
So it's really easy to find me. You can Google my name, but my website is drkarenhorton.com. On Instagram, I'm Dr. Karen Horton. I have a second account, Dr. Karen Horton before and afters. I have an all before and afters account. And it's not as widely followed. I don't have as many followers, but patients will come see me and say, I'm here because I like this result, and it's from my Instagram account, and you have to cover up nipples and pubic hair a little bit.
Mm-hmm. Yeah.
But yeah, I'm not on TikTok. I have a TikTok account. I'm not really active in that. Okay, you can't do everything.
You can't do everything. Yeah.
Yeah,
but you guys should definitely check out.
Yeah, I'm here. I'm honest. I record a lot of videos, as I know you do as well. Your videos are amazing, and your husband does a great job helping you with them. Yeah, they're really great. But yeah, I put myself out there. My goal is always education, being really forthright, and sharing little snippets of my personal life too.
And you all should definitely check out Dr. Horton's social media because you do a really great job with educating. I always tell people too, like, don't worry about follower counts when you're looking at a plastic surgeon's work. That's just one thing out there. There are so many amazing plastic surgeons who have just these fantastic accounts and fantastic results. So check everybody out because you just never know where you find your perfect match.
Yeah,
so.
I agree. Definitely. There's someone for everyone.
There is. And thank you again so much for being on the show.
Thank you.
And thank you all for listening today and I hope you enjoyed this episode of the Confidence Doc Podcast. And as always, I hope you learned something. Talk to you all and see you all next time.